Okay, yeah, thank you all for being here. My name is Katherine Monroe, and I'm a molecular biology student going into my junior year at Princeton University. I'm also considering minors in cognitive science and global health and health policy. But after being here this summer, I'm also kind of thinking about Latin American studies, so we'll see. So what have I been up to these past 2 months? It's really been a whirlwind of an experience, and I feel like I've gotten the chance to see so much of the country in such a short amount of time. We've been going on a lot of medical caravans as a group, and in the caravans, my main role has been helping with Hilal's cervical cancer screening program. And so for me, that's been a really incredible opportunity to kind of interact with patients and work with Dr. Donald, our gynecologist here. And then for the past few weeks here in Riobamba, we've been doing a lot of shadowing at Hospital FIBUSPAM, and I've been spending a lot of time with my homestay family, getting to know the kids, and of course working more on this research project, which I'll be speaking about today. Um, so I was initially drawn to this topic of water safety and waterborne illness because of how complex and multifaceted it is. Obviously, I have an interest in microbiology and global health, and so this has been a really great opportunity for me to kind of dive a little deeper into epidemiology and disease transmission. And it's also given me the chance to learn a lot more about water infrastructure and sanitation practices, which I didn't know a lot about before. And ultimately, I really believe that addressing these issues is fundamental to improving public health and making a difference in people's daily lives here. And so this quote here is pulled from the United Nations Sustainable Development Goals. Goal 6 is to ensure access to water and sanitation for all. And that's because access to safe water, sanitation, and hygiene is the most basic human need for health and well-being. And so I really do feel that tackling this issue is key to taking care of people's health needs here in Ecuador because it is the well, so to speak, from which so many other problems spring later on down the line. And so this is a brief overview of the work that I've been doing in the past few weeks. I started by reading a lot of literature to get a sense of what water access, water quality, and waterborne illness looks like here in Ecuador. Then I moved into conducting interviews and surveys with staff and patients at FIBUSPAM. Um, and doing this kind of survey-based fieldwork was a new experience for me, and I found that I really enjoyed it. It was rewarding to hear people's personal perspectives and experiences, and it was also really informative for my project. And then finally, I was able to travel to Lanlan, which is an indigenous community in the mountains, and learn more about their water systems and kind of get their community perspectives on water safety. And then next, here are some statistics to give you a sense of the magnitude of the problem when it comes to waterborne disease. So first of all, I wanted to underscore that acute diarrheal disease, like that caused by many waterborne illnesses, is the second most common cause of death in children under 5 in developing countries. And so this chart to the right here gives you a sense of the types of waterborne illnesses that are common here in Ecuador. This is from the Ministry of Public Health, and we can see that, for example, despite being a preventable disease, hepatitis A is a fairly common waterborne illness here with over 1,000 cases in 2024. And so typhoid fever, shigellosis, salmonella, they're also up there. And then we see that there were over 10,000 cases of other unidentified causes of food poisoning that occurred. Um, and I also want to emphasize that these cases are very likely undercounted. One paper noted that many cases do not seek medical attention, and for those that do, the causal agent is not always detected. And then all of this very much aligns with reports from doctors at FIBUSPAM who see patients with symptoms of waterborne disease nearly every day. So, for example, the family medicine doctor that I talk to sees nearly 3 to 4 patients a week with these symptoms, and in gastroenterology, more like 1 to 2 patients per day with these symptoms. And then I also looked into the impact of waterborne illness on indigenous communities, which experience greater isolation and higher rates of poverty, which makes them especially vulnerable. And so from this graph, we can see that from 2011 to 2020, indigenous people had the highest in-hospital mortality rates from waterborne disease out of any ethnic group in Ecuador. And I also looked at a study of two indigenous Shuar communities in the Amazon, and they found that 98.1% of the people that they tested had had contact with hepatitis A virus, and 50% had come into contact with the bacteria that causes leptospirosis, which can also have very serious complications. And then, of course, when we're talking about waterborne illness, we have to look at the source of the problem and place it in the context of the existing water infrastructure of Ecuador. And so, although a vast majority of municipalities do attempt to treat the drinking water, the UN reported around 30% of the population still lacks access to what they call safe water management, meaning that their water is either unclean or inaccessible. And this is primarily due to poor water quality, with 26.6% of the water being contaminated with E. coli, indicating fecal contamination. And this is also exacerbated by old and damaged plumbing and insufficient sewage coverage, which is especially prevalent in indigenous communities and in the Amazon region. For example, here, nearly 80% of indigenous children do not fulfill the UN's water, sanitation, and hygiene indicators, compared with 48% of children countrywide, which is still a pretty significant number. And then finally, a few more considerations are that contamination often occurs between the source of treated water and the point of consumption, which is often through damaged plumbing. And then also, while 79.1% of urban households had safely managed water services, that number was only around 51% for rural households. And water quality actually decreased from 2016 to 2019, perhaps due to increased precipitation. I also found it really interesting that water quality increases along with the education level of the household head. And then finally, a lot of these statistics are a couple years old, and so there is kind of a lack of literature and research surrounding some of these topics as well. And then finally, when it comes to tackling this issue, it's going to be important to understand and address cultural norms and perceptions surrounding water use. And now I'm going to move into the findings of my survey and interview work at FIBUSPAM. So I interviewed 10 patients about their experiences with waterborne illness and water quality. I found that 9 out of 10 had some degree of awareness of waterborne illness, with salmonella being the most widely known. 6 out of 10 reported knowing someone who had experienced symptoms aligning with waterborne illness, and of those 6, all but one sought medical attention, some at public health clinics and others at private hospitals, and the main treatment that they indicated being prescribed was antibiotics. And some of them recovered quickly, but others reported the illness lasting as long as 30 days. And then interestingly, 5 patients reported sometimes or always drinking tap water, while the other 5 reported always boiling or drinking bottled water. And then finally, 9 out of 10 patients believed that the community or government should take action to improve the quality or access of water. I also interviewed some doctors at FIBUSPAM who reported that waterborne diseases such as E. coli, salmonella, and brucellosis are quite common at the hospital. One doctor explained that he had recently treated 3 children from Huamote with jaundice and fever from hepatitis A, and that infections of this kind can last for nearly 40 days. And one consideration is there is a vaccine for hepatitis A. However, a lot of children do not receive this due to home births being more common in the area. Also, living in close contact with livestock and drinking unpasteurized milk can increase risk of waterborne illness. And he raised the issue that there are high concentrations of minerals in the water in volcanic regions like Chimborazo, which can contribute to a variety of other health problems as well. And then finally, some indigenous communities in both the Amazon and the Sierra simply do not have access to water sources and must bring in water through canals or pipes, which frequently have insufficient sanitation. Doctors also emphasize the idea that lifestyle habits surrounding water are hard to change, and some lifestyle factors, like living with livestock, for example, are kind of unavoidable for some people. Another consideration is that clean drinking water is a human right, and so although we can and should encourage people to treat their own water at home, that responsibility really shouldn't fall on them. Customs may also differ between rural and urban populations. For example, like people in rural areas m may be more accustomed to buying bottled water. And doctors also told me that they believed insufficient education and lack of economic means were significant barriers to accessing clean drinking water. Okay, and now more findings from the field. So finally, I went to visit a town in the Flores region. Um, this picture that you can see on the screen is a picture that I took of the view. My homestay family is Quechua speaking, and they have connections in a town called Lanlan. And so I had the privilege of meeting with the town council, um, to learn more about their water system and hear their thoughts. And so here I am pictured with members of the town, and to the right here is Puma Pomaquero, who is one of the community leaders, and he helped translate from Quechua to Spanish for me. I've actually been taking Quechua lessons while I've been here, along with one of the other interns, Colin. And that's been a really great experience, but I'm afraid I'm not quite at working proficiency yet. Um, and so what I learned is that around 25 years ago, the community invested in a pumped and gravity-fed water distribution system that utilizes groundwater and chlorination to distribute water to individual homes. And this was with the help of an organization called World Vision International. And so pictured here to the left is the groundwater pumping station that I was able to visit in person. Um, I also gained a lot of insight from speaking with members about the history of water access in their community. For example, they told me that before they implemented their current water system, they would have to walk to the groundwater well at 3 or 4 in the morning in order to get clean water and carry it back to their homes. Um, but they told me that their current system seems to be functioning well. They did not report any instances of waterborne illness, although most of the community does drink from the tap. And in cases of illnesses, they said that they typically treat it at home with traditional herbs, rather than seeing Western doctors. However, they did express a desire to have their water quality reassessed and also have old plumbing replaced as they're starting to see evidence of deterioration in the pipes. Finally, I wanted to highlight this quote that I heard over and over again from one doctor at FIBUSPAM. He said, "En Ecuador no existe atención primaria. In Ecuador, there is no primary care." And so this is to say that the vast majority of patients wait to seek medical attention until their illness or injury has progressed to a severe degree, which makes treatment less effective and also extremely costly. And so if we truly want to take care of our patients' health, we need to focus on preventative and primary care, in addition to curative medicine. And that means addressing issues like clean water access. And so, what can we do about these problems? First and foremost, we can give people the tools and the knowledge to treat their drinking water. In my interviews with patients, they listed concerns about the safety of the drinking water and expressed the desire for more thorough sanitation and filtration of the tap water here. Education also stood out as a theme in the interviews. Many people are unaware that drinking tap water poses an issue, especially in rural areas, and those that are often fail to consistently treat their water. And FIBUSPAM already visits many of these communities on medical caravans, which would make it easy to deliver educational charlas or community chats and informational materials. FIBUSPAM could also deliver water filters that could be installed for communities, schools, or homes. Um, and then here to the left, or to the right, I have a number of organizations that are working on water access and treatment in Ecuador and could be potential partners for um, partner organizations for PACH in the future. And then in the medium and long term, we should continue to engage communities by conducting follow-up studies, supporting the replacement of plumbing, and advocating for infrastructure and policy investment. In conclusion, acting on this issue of water safety is crucial to alleviating the burden of waterborne illnesses on an already strained public health system and to taking care of child health and nutrition. And I think that PACH and FIBUSPAM can be a part of the solution. To reiterate, we can play a key role in raising awareness and education surrounding proper treatment of water and providing technology and infrastructure to communities in need. This is essential to realizing PACH's goal of fostering sustainable healthcare systems and improving community health and well-being by providing not just curative, but also preventative healthcare. I want to leave you with this quote. Water is life's matter and matrix, mother and medium. There is no life without water. And then finally, I'd like to give some acknowledgements. My deepest thanks to Zach Smith, the staff of Hospital FIBUSPAM, Dr. Kore Pomakero, Puma Pomakero, the people of Lanlan, my fellow interns, and my homestay family. Thank you also to PACH and the Office of International Programs for supporting this project and making this incredible experience possible. I feel like I've done and learned so much in this short time, and it's an experience that I will definitely continue to reflect on and treasure for the rest of my life. So thank you very much. And I'll now take any questions if you have them.